An update about what I know about that abnormal, unusual, atypical upper respiratory infection that I'm sure everyone's heard of in the news that's affecting dogs right now. Well, here's a list of the current states that are being affected, and we'll talk about who's at risk, what we do know about the pathogen, what typical treatment protocols are and atypical treatment protocols, and then how you can work and do things to help prevent the risk of your dogs getting this. So we don't know a lot about it. There's talk about potential isolated bacterium that could be it, but it's a difficult scenario. They do know that it is mostly close contact between dogs. So they do talk about things. Apologize, my cat's back there, Rio's talking because he knows he's not as susceptible to this. But you can get COVID, dude, so you got to be quiet while I talk about this. He's not going to listen. We do know that there is a pathogen involved. They're working on isolating it. There's talk about it being just a mutation of the influenza virus that could be out there, some sort of mutation, some novel bacterium, but it's still unknown and they're working on it. Number 2 is that the signs and symptoms would be typical of upper respiratory, weepy eye, sneezing, coughing. Really of concern is when your dog becomes lethargic, has difficulty breathing and not eating. My advice to you would be any sign of upper respiratory, call your vet. The treatments involve the progression of pneumonia in dogs. And so for the treatment of pneumonia in dogs, they're typically utilizing oxygen therapy, nebulization, and IV antibiotics, and they're hospitalized. Dogs that are at risk are typically the flat-faced dog breeds we call brachiocephalic, Frenchies, bulldogs. Dogs that have a concurrent illness, doesn't matter what it is, but dogs that have illnesses tend to be immunocompromised. Illnesses can range from long-term kidney issues to cancer. You have some sort of immune-compromised situation that makes these dogs more susceptible. So really keep an eye on those dogs. And dogs that frequent multi-dog scenarios. So there's talk about, really being diligent about boarding or grooming, and be very careful with that. The boarding facilities and grooming facilities that I utilize typically do really good cleaning between patients. Apologize again, my cat is cat being a cat. The biggest thing I could advise to you is in addition to looking at the clinical signs, in addition to being diligent about boarding, grooming, multi-dog scenario, is keep your dog updated on vaccines. So, there are talks about concurrent illnesses occurring. So one of them would be the kennel cough. So there is a vaccine for kennel cough, the Bordetella vaccine. There is a vaccine for the 2 strains of influenza we've isolated in dogs. It's canine influenza vaccine. So keeping up to date on those vaccines minimum, but vaccines in general, is really important because it helps protect from secondary infections. And I always get the scenario where clients will call up literally a day before boarding saying they need the Bordetella or kennel cough vaccine. It's not going to kick in by then. It's not going to kick in for like a couple weeks. So really be diligent about planning your situations, your scenarios. And I know there's a lot of stuff going on with the holiday season and everything like that, but you got to be really careful about things like that. So we don't yet have it isolated. The signs and symptoms are, remember, coughing, sneezing, wheezing, lethargy, difficulty breathing, not eating. Call your vet immediately. Be mindful of multi-dog scenario situations and keep up to date on your vaccines. And those are methods, until we get a better handle on things, of how you can limit the spread and possibly even prevent this disease from getting to your dog. Remember, everyone, love your pet like they love you, unconditionally. Have a great day. This is not a dog, but this is the guy causing all that little trouble in there, right, bud? Right? Oh, you're not talking now? You talk away when you're off camera. You always never talk when you're on the camera. Okay, don't look at the camera. You gonna talk? What do you think? Huh? Yeah, I knew you were gonna talk.